Alzheimer's disease and other dementias, understanding symptoms, impact, and management. Alzheimer's disease and other dementias are a group of progressive neurological disorders that primarily affect cognitive functions, leading to memory loss, impaired thinking, and altered behavior. These conditions have a profound impact on individuals, families, and societies, demanding comprehensive understanding, early detection, and effective management strategies. This article delves into the symptoms, challenges, and potential approaches to dealing with Alzheimer's disease and other dementias. Symptoms and progression. Dementias, including Alzheimer's disease, typically begin with subtle changes in memory and cognitive abilities. As the diseases progress, the symptoms become more pronounced and interfere with daily life. Common early symptoms involve forgetting recent conversations or events, misplacing items, struggling to follow a conversation, and difficulty making decisions. Over time, individuals may experience confusion about time and place, difficulty recognizing familiar people, and trouble with language. Behavioral changes like irritability, anxiety, and depression are also common. The progression of dementia varies from person to person, but it generally follows a predictable pattern. In the later stages, individuals may lose the ability to communicate verbally, require assistance with basic activities such as eating and dressing, and become more susceptible to infections. Dementia ultimately impacts a person's independence and quality of life, necessitating comprehensive care and support. Types of dementia. Alzheimer's disease is the most common form of dementia, accounting for about 60 to 70% of cases. It is characterized by the accumulation of abnormal protein deposits, amyloid plaques and tau tangles, in the brain, which disrupts communication between nerve cells and leads to their eventual death. Other types of dementia include vascular dementia, which results from reduced blood flow to the brain due to strokes or other vascular issues, Lewy body dementia, which involves abnormal protein deposits in nerve cells leading to cognitive fluctuations and visual hallucinations, and frontotemporal dementia, which affects the frontal and temporal lobes of the brain, causing changes in behavior and personality. Impact on individuals and families. The impact of Alzheimer's disease and other dementias extends beyond the affected individual to their families and caregivers. Family members often experience emotional distress as they witness their loved one's cognitive decline. Caregiving can be physically and emotionally demanding, leading to burnout and strain on relationships. The financial burden of dementia care can also be significant, as individuals may require long-term care services and medical treatments. As a result, families may face challenges in managing their own lives, careers, and responsibilities while providing the necessary support. Diagnosis and treatment. Early diagnosis is crucial for managing dementia effectively. Diagnostic tools include cognitive assessments, brain imaging, MRI, CT scans, and blood tests to rule out other potential causes. However, definitive diagnosis of certain types of dementia, like Alzheimer's disease, often requires examining brain tissue post-mortem. While there is currently no cure for most dementias, interventions can help slow down the progression of symptoms and improve the quality of life for both individuals and caregivers. Medications can temporarily alleviate cognitive symptoms and behavioral disturbances, although their efficacy varies. Non-pharmacological approaches, such as cognitive rehabilitation, physical activity, and social engagement, have also shown promising results in maintaining cognitive function and enhancing well-being. Support and care strategies. Creating a supportive environment for individuals with dementia is essential. This involves adapting living spaces to minimize hazards, establishing routines, and providing sensory cues. Engaging in activities that stimulate the mind, such as puzzles, music, and art, can help maintain cognitive function and emotional well-being. Family caregivers need resources and support as well. Caregiver education programs, support groups, and respite care services can offer relief and guidance to those who bear the responsibility of caring for someone with dementia. Research and future directions. Advancements in understanding the underlying mechanisms of dementia have led to ongoing research efforts to develop disease-modifying treatments. Targeting amyloid and tau proteins, as well as exploring inflammation and genetics, are areas of active investigation. Early detection methods and biomarkers are also being explored to improve diagnostic accuracy. In conclusion, Alzheimer's disease and other dementias present complex challenges that touch every aspect of an individual's life, their families, and society as a whole. Recognizing the early signs, seeking diagnosis, and implementing comprehensive care strategies are essential steps in managing these conditions. By raising awareness, supporting research, and providing effective care, we can strive to improve the lives of those affected by dementia and move towards a future with better understanding and treatment options.